Hello, good morning again, and welcome to another Wednesday where we'll bring you AM Business, is brought to us courtesy EcoBank, the Pan-African Bank. Now, with a suspected reported case of the coronavirus now in neighboring Cote d'Ivoire, also in Kenya, authorities are on high alert to check passengers at the nation's main port of entry, the Kotoka International Airport, to avert any spread of the disease by incoming individuals. Traders, on the other hand, fear the disruption to travel can have negative impact on prices of goods. So today on AM Business, we explore the impact of the viral outbreak on business and the nation's preparedness in containing the spread.
Every day, thousands of people ply Ghana's main airport, the Kotoka International Airport. But there's a threat: the outbreak of the coronavirus, which has left the world in a panic. Reports that we have so far indicates that the death toll for this particular disease in China is at 26, and over 830 persons have also been affected within the same country. Subsequently, the disease is reported to have spread out to about 8 other countries, which has caused some amount of alert globally on how to check and curb the spread of this new deadly virus. Already, neighboring Ivory Coast has reported its first suspected case of the coronavirus, leaving questions about how prepared Ghana is in containing the virus. We put these questions to the head of Port Health at the Kotoka International Airport, Gideon Akwe. So far here at Kotoka Terminal 3, has there been any suspected cases, or have you had any issues so far here at the Terminal 3?
No, there's no suspected case as at now.
So for now, though, what are the protocols in place to check the passengers that are coming in to ensure that we don't have any incidences?
When they come, we have the health declaration form. This is the form we give to all the travelers or the passengers. We give to the travelers or the passengers to fill at the upper arrival before getting down to the screening points. We have thermal scanners. So after filling the form, when you go to where the thermal scanner is, the thermal scanner will pick your temperature. When your temperature is above the threshold, that is, when it is above 37.5, we have a light in the thermal scanner. It will show red. So when it shows red, quickly we have an officer who will politely ask you to get aside the queue. The officer will interview you. Then we use this non-contact thermometer to re-check your temperature again. If still it is above the threshold, we have F-team here. We have the Port Health, airport clinic, and the ambulance. So quickly we have to inform the airport clinic, the ambulance. Then we also have to inform the International Health Regulations focal person.
In terms of, let's say, in terms of isolation units, in terms of even ambulances and equipment, are we planning to add up more just to ensure that we are really on point?
Here we have 2 ambulances. And at Rava Hall, we have 1 holding room there. Airport Clinic 2 is also having another holding room. So here, when there's a case, we will not allow you to enter the port. Holding room, we have entrance to the tarmac. So ambulance will just pick you at the tarmac straight to the clinic to reduce the spread or the infection.
The team was granted rare access to the arrival section of the airport. Here we noticed something unusual. Customs and immigration officers were all in protective gloves and nose masks.
We were given directives from our commissioner and the sector commander, Madam Molly Awaji, that we need to intensify our protective measures here.
Chief Revenue Officer in charge of Terminal 3, T.D. Williams, explains the high alert rate of officers at the airport since the outbreak of the coronavirus.
Wearing our gloves, as you've seen, and the mouth mask. In addition to that, we make sure that even the goods that we handle, whether passengers are with them or not, we at least wear our hand gloves to ensure that we are protected. After that, officers are required to take some kind of hygienic measures, wash their hands, and as you can see on the table, we have the hand sanitizers. We have to use it periodically.
Are you by any chance fumigating or anything of that sort to check some of these things coming in?
Yes, the airport authorities are always regularly fumigating. I believe they are taking immediate measures. The port health authority officer came to me this morning and assured me that they are going to fumigate the areas where we work.
Barbara Sam is the Assistant Superintendent of Ghana Immigration.
So Ghana Immigration Service, this is a health issue, so the Ministry of Health is handling this. But for us as a service, we have put certain measures in place to prevent our officers from getting this virus. And the measures are, we've provided them with face masks, we've given them gloves, and then we've also told them to wash their hands regularly, and then also look out for symptoms when passengers arrive and report the passenger immediately to Port Health, and also to be alert. That's all.
Despite these measures, however, some still argue that passengers traveling from China should be quarantined and rigorously screened at the airport. So from the strict and thorough checks of passengers by the thermal scanners, as well as the port health authorities, and the wearing of protective gear such as the hand gloves and the nose mask, and the presence of hand sanitizers on almost every desk here at the airport, one can say that the stakeholders and authorities here at the Kotoka International Airport are on the beat and have stepped up measures to ensure that everybody is safe and this coronavirus does not cross our frontiers. Meanwhile, on the global front, with regards to air transport, the International Air Transport Association, IATA, has issued a statement that it is monitoring the situation. The statement read, IATA is closely monitoring developments related to the coronavirus outbreak in Wuhan, China, and is actively engaged with the World Health Organization Secretariat, ICAO, and the U.S. Centers for Disease Control. WHO is advising measures to limit the risk of export or import of the disease without unnecessary restrictions on international traffic. Airlines are prepared to work with the public health authorities when there are outbreaks of communicable diseases with well-developed standards and best practices. As the fears of contamination from travel linger, some traders and importers who source their wares from China say they may halt travel in the interim, which they fear could hike prices of goods.
I'm not going to China anytime now, and I don't know when I'll be going, but we import. So that is why I'm talking about the fumigation of the containers, because I can still be here and my goods will come. So I feel they need to fumigate them so that we could be safer. You know, I can't go there to see the goods for myself. So definitely one way or the other, I'm not going to have 100%, I'm not 100% sure doing business with them, because when the things come, whatever is inside, I have to adjust it. But if I'm there to buy, it's a different ball game. So definitely it's going to have an effect on my business.
Because of the lockdown of some of these, 17 places in China, definitely it means goods will not be coming into the system, into Ghana. And as a result of that, it will create some shortage, and that shortage may lead to some price hikes. And that will be the impact that we anticipate, at least for the immediate future, because these things are not planned for. So you cannot just take immediate, you cannot have immediate response and then sort of salvage the situation. It's not going to be that easy.
People who have enough goods at their warehouse have the edge now. But if your goods is on the way coming and it's being locked, then you are on the other side. But I think the scary bit of it is when we hear that about 9 countries in Asia have now got the disease. Then it is scary. It is scary. So I think something needs to be done.
Deputy Trade Minister Carlos Ahenkra also cautions traders to be extra careful during this period.
Of course, I've heard and I've seen on the media landscape what is going on in China, but I wouldn't have any evidence to support. But however, you can't take some of these things for granted. I will take opportunity of this engagement to inform our traders that they should be careful. Those who intend going to China, I would say just watch where you go and let's be careful how we interact. Even though I think they seem to have the situation under control, you know that when it should come to our part of the world, it will be very, very disastrous. Unfortunately, I hear that it is spreading more than we thought, cases have been reported in the U.S., South Korea, and so on. And even as close as Cote d'Ivoire, we hear that there are some cases that have been detected in just next door, which doesn't spell too good for us. So let us be careful how we go around some of this information when we hear them.
As efforts continue on how to contain the virus, Hong Kong on Tuesday implemented a broad series of restrictions aimed at controlling the spread of the coronavirus, including limiting the number of mainland Chinese travelers entering the territory, one of Asia's busiest travel and financial hubs. Global stock markets on Monday also took a sharp downturn as investors grew increasingly anxious about the swift spread of the coronavirus beyond China.
And that's AM Business on this issue of coronavirus and its impacts on local businesses and businesses elsewhere. We will talk about this a lot more, but just so you know, coming up on the show, also we're talking about this latest trend of substance abuse where young people are now smoking dried feces. Unbelievable. They are also soaking sanitary pads and drinking for vitality. Absolutely absurd, some people would say, but this is a latest trend and we've got to talk about it and see how we can get out of this. But let's stay a while longer with the coronavirus. Roland Walker is going to give us an update in terms of the number of people dead, where the cases, where this virus has spread to. We're here in Ethiopia, Kenya, Cote d'Ivoire, suspected cases there as well. So Roland Walker, over to you.
Well, the ultimate thing is that, Mamavi, we do have Wuhan, which is the main city where we have the case first detected and emerged and ultimately locked down. And just this morning, the BBC spoke to a couple of the African who not only are studying there but living there, and they said the whole city is locked down. It means that you can't even go to the airport if you want to go evacuate. It will be difficult. We also do know that Ministry of Information is doing as they could to make sure. The
Ministry of Foreign Affairs.
Foreign Affairs is also doing as much as possible, liaising with its international partners, with our embassy also in China to get the right things going, to see whether the right sort of evacuation could be undertaken, which I don't know is possible, because the latest we're getting on the BBC and the rest of the international media is indicating that we have flight at least suspended coming into Britain, even though we've had some sections of flights going into Australia, which is closer to Asia than normal. And it's also indicating that at least we have about a number of the flights with the British Airways suspended, all direct flights to and from mainland China because of the virus outbreak. And this is the latest coming from the BBC. It comes after the UK Foreign Office advised against all but essential travel to the country. And it continues that the virus has caused more than 100 deaths, which we told you 132, in fact, inching close to 6,000, as has been reported, not only in China but across the world. Now, look, it's spread to 16 other countries, and in Africa we have Kenya, Cote d'Ivoire, suspectedly, and also Ethiopia, all also reporting suspicions of people they're monitoring and also giving us those indications. Now, currently there's a press conference that is ongoing with live streaming from CCTV, China's main state media agency, but the island quarantine plan as foreigners also leave. It also indicates that hundreds of foreigners fly out of Wuhan, as Australia also announces a Christmas island quarantine plan, and that ultimately would give the whole insight as to what is being done. Here in Ghana, the Ministry of Foreign Affairs, in its latest statement, is indicating that they wish to assure all parents, relatives, as well as friends of Ghanaians in China that the embassy, Ghana's embassy in Beijing and the Consulate General in Guangzhou, where we have tons, if not dozens of our traders, hundreds actually, with their Chinese-related business partners trooping in and out of the route. We're talking out of the Kotoka International Airport, flying through the Middle East into mainland China, into Guangzhou especially, which is the hub where we tend to do many of our trade and commerce with our local importers, where they are making sure that the right things are done in trying to liaise with them. Because the mission has so far advised all Ghanaians, according to the statement, to stay indoors, which is also the main advice coming from the Chinese government and the various provincial heads to all people, whether of Chinese descent, Chinese or other nationals living in mainland China. And currently, according to the state, there's no Ghanaian has been reported to have contracted the coronavirus, even though about 150, and now the cases have increased so far. But the student we have in Wuhan is indicating that the number about 152. And again, the embassy is in contact with these students and is liaising with the leadership of the student body in China, especially the Wuhan Foreign Office and universities, to ensure that the continuous stay of Ghanaian students and the provision of their basic necessities are ensured, because this is crucial. If you take a look at what the emergency situations, the evacuations and the lockdown approaches that have been adopted by the Chinese government, is to ensure that transportation is at a standstill. So even the speed trains, the normal just slow trains really are not moving. And the various shops are also not working, and it will mean that what you have by way of groceries, your own provisions, are what you tend to have. They're making sure that when the time is right, then they can do the evacuation. So far, the British, through its main airline, the British Airways, they've suspended all flights. And again, there's all the indications that Australia could also do same, as well as other airlines possibly. But look, if you're watching us through any of our satellite viewing point and you want to get the contact numbers for the consulate of Ghana, especially in the Hubei province, you can do so through the number +86186120 84232, or subsequently the next one +86186129599040. But as we already indicated, the Chinese government, they are currently having a press conference to give all those assurances and the steps so far that have been taken. It's live on the China, and this is happening on China's main television state station, CCTV. You can, again, make sure you go onto YouTube and get the latest update from there as well, just to keep information always around you. But the Chinese authorities have also indicated what needs to be done for people who are part of all this lockdown, just staying in China. But the World Health Organization, we also have our own public health safety assurances given by the Ghana Health Service, and it's indicating what needs to be done. We'll bring you these graphics, which is indicating that for prevention of any spread, avoid touching your eyes, your nose, for example, your mouth with unwashed hands. It also means that if you go to and fro out of buildings, facilities, shaking people, you always need to wash your hands with soap consistently. Stay home when you're sick. Also avoid close contact with people who also not well, especially with flus and other forms of respiratory infections if you suspect. Make sure also you cover your mouth if you're sneezing with a tissue, and then throw the tissue in the trash bin subsequently when you do that. Also clean and disinfect frequently as you touch objects and surfaces. It's very important. We need to observe these because it's closer to us than we think. Remain alert if traveling to other parts of China. And we know that we have a lot of Ghanaian as well as other foreign travelers who always are on the Kotoka, Dubai and China route, or Accra, Middle East route to China. And it will mean that these travelers to China should avoid contact with sick people, discuss travel to China with their healthcare provider. Older adults and travelers with underlying health issues may be at risk for more severe disease, because when you are infected already with the disease, your immune system is low. Ultimately, that puts you at risk. You're more predisposed. It continues that avoid animals, live or dead, animal markets, especially in China, and products that come from animals, such as uncooked meat, and we also do know the Orientals. They tend to eat a lot of their food a bit just slightly steamed and uncooked. Wash your hands often with soap and water for at least 20 seconds. Use an alcohol-based hand sanitizer if soap and water are not available. So we all need to have all these precautions. If you travel to China in the last 14 days, you're in Ghana, you went to China, Guangzhou, etc., but you're not feeling well, make sure you report to the nearest health facility, especially when you're having difficulty in breathing, you're coughing, you're experiencing some fever, etc. You seek the right medical advice. And if you're in that state, avoid any sort of contact. So you're somewhere in Kumasi, just traveling from China over the last 14 days, you're not feeling well, make sure that you don't continue touching people or getting into contact with people, and not travel while you're sick, because it's also important. Cover your mouth and nose with a tissue or your sleeve, not your hands. It has to be with a certain material or surface when coughing or sneezing, so that you don't infect others and infect yourself. Also, wash hands often with soap and water for at least 20 seconds. Use an alcohol-based hand sanitizer if soap and water are not available. And this is where you need to get the latest update. We'll again show you what's taking place, the press conference live on CCTV. It's the main information bureau of China, the People's Republic of China, that's doing this. And this press conference is indicating there have been many restrictions on travel across various provinces and regions in China. Already we're getting the indication the British Airways officially, they have stopped all forms of travel. No flights into China, out of China. So if they have one in or several in China, which of course they will have, those are all under lockdown. Again, the station on YouTube is CGTN. Make sure that you go there, get the latest update when it comes to YouTube. We also do have our streams available, Majorline TV. It's where you can get the latest updates. Nowhere else in Ghana would you be updated except right here